Good afternoon and welcome to this meeting of the Indiana Justice Reinvestment Advisory Council. My name is Chris Goff. I serve as an Associate Justice on the Indiana Supreme Court, and I have been appointed by Chief Justice Loretta Rush to serve as JRAC's chair. Later in the agenda, members of JRAC will be asked to make brief presentations on behalf of their agencies and the work that they might be conducting of benefit to JRAC. The first item of business this afternoon is approval of the minutes from the last JRAC meeting, which was held on April 23rd, 2021. Prior to the meeting, copies of those minutes were distributed to all JRAC members. If you've had an opportunity to review the minutes, I would, when you're able, entertain a motion to approve the minutes.
This is Doug. I'll motion to approve the minutes.
Thank you, Doug. We have a motion.
Second.
Right. Thank you, Senator Talion. Motion and a second. Any further discussion? Very well, then I call for the question. All those in favor of approving the minutes from the April 23rd, 2021 meeting of JRAC, please indicate by saying aye.
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 Any opposed? Right. Very well. Motion carries. The next agenda item is to receive reports from JRAC work groups. And so this afternoon, we're going to hear reports from the Community Corrections Code Revision Work Group, the Racial Equity Work Group, and the JRAC Indiana EBDM Work Group. First, go ahead and quickly, I hope, dispense with the meeting from the Community Corrections Code Revision Work Group. I say quickly for purposes of today, but this is going to be quite an undertaking. I have served as chair of this work group, and we had an initial meeting last week, and was very well attended, and there was a great deal of interest by those in attendance. We're going to conduct at least three, probably 2-hour sessions of that work group in advance of drafting a report in accordance with the new JRAC statute. There was some discussion during last week's meeting about forming a smaller work group in order to facilitate the discussion and suggestions. But actually, there was so much interest in the smaller work group that we may be carrying on with largely the original work group intact. So that's all I wanted to report on with respect to the work of the work group to this point. But I'd ask Mary Kay or Chris Blessinger or anyone else who might have attended if they have anything else to add.
Justice Goff, I don't have anything to add. I was just really excited about the level of interest and the groups that were represented on the work group. They're different perspectives, and so the idea moving forward is to capture and to review the code in the context of all the different perspectives of these stakeholder groups. And I think it's going to be a really valuable discussion. So thank you.
Thank you. Chris, do you have anything to add?
Justice Goff, she's actually coming from another meeting, so she'll be a few minutes late.
However, no
she
problem.
may have something to add once she joins.
Anything else from any of the other members who might have attended? Well, hearing nothing, I would just echo Mary Kay's comments. So thank you very much for your interest, and this really exciting project I think will benefit a lot of people. I'd next call on the Racial Equity Work Group, and for a report out, I'd call on Bernice Corley and Steve Luce.
Good morning, Justice Goff and members of JRAC. I think we reported last time, Steve and I, that there was some consideration of Dr. Louder working with the group and assisting us. So since that last update, a small group of the work group met with Dr. Louder to talk about ways that she could assist the racial equity work group, and we're really in kind of the development phase. So Dr. Louder is going to work up a proposal, and then the work group will meet with Dr. Louder. The full work group will meet with her and talk about it. We're still working on nailing down our next meeting. I know that the options are going to be in the week of this month, June 21st, that week. So that's where we are at this point. I don't have anything else. Steve, did you have anything else to add?
No, I'm good at this time, Bernice. Thank you.
Well, Bernice and Steve, thank you for your hard work and your leadership on the work group. We're excited about Dr. Louder's involvement as well. Mary Kate shared that with me, so look forward to hearing from you in an upcoming meeting. I next called in for a report out from the JRAC Indiana EBDM work group, and for that report out, I'd call on Judge Spitzer and/or Amber Finnegan and Angie Hensley Langrell.
I think Amber was at the last meeting, should probably give us an update
Great.
on that. Thank you.
Thank you.
The EBDM had a really good conversation about just what this is going to, what the new local JRAC is going to look like at the local level. And there is a proposal submitted by Mimi Carter in having the Center of Effective Public Policy assist the state in helping counties form this new local council and get it rolling off the floor. So I believe a copy of that proposal was sent out to the committee members, and the EBDM members would recommend that JRAC accept that proposal on forward, moving on forward to just provide assistance coming from the local level. It is really, really, I think, important not only to train people at the local level on how to administer meetings that consist of this, but also just having an outside perspective and having an outside person come in and help navigate that is very valuable. And I just can't express how valuable that is in assisting the locals taking on a really big and important project like that. So that was one half of the evidence-based decision making. We feel, the committee does feel that we could expand our role with this and continue on with this project to kind of be that state agency that helps oversee this local implementation of JRAC. So we would also recommend that JRAC continue the evidence-based decision-making committee beyond this initial project, which was going into the center, coming in and doing a report on the efforts that Indiana has already done on evidence-based decision-making, but expand that also to be kind of a central hub to kind of oversee the implementation of the local JRACs across the state.
Thank you, Amber. And I know Mimi Carter is on the call today, so welcome, Mimi. We're glad to have you here. And Amber, I heard, I believe, a request then for two action items. One was that Mimi become a part of our statewide movement again, as suggested in her letter. I think that was distributed to JRAC members. And then also that the larger EBDM movement be continued through JRAC. Am I hearing you correctly?
Yeah, I believe the original purpose of this group was to assist Mimi with this with the project that they are concluding up with the evidence-based decision-making project. So we would just like this committee to go beyond that scope and to be an overseer of for helping implement the local JRAC into at the local level.
Thank you. Mimi, I appreciate you being here today. Is there anything that you'd like to add to the discussion before we call on members?
Thank you, Justice. It's great to be with you. And I guess the only thing I'd like to add is I want to thank the committee for all the work they've done to support this case study project. And you might be interested in knowing that some 30 people have been identified to be interviewed as a part of this project. And we sent out invitations, and I think we probably have 25 people that have responded and signed up, which is unheard of in my world. So I just want to thank everybody for their great work and their participation. Well,
on behalf of, I think, all our members, we've got some very interested folks who are really excited about this work. So we're thrilled to have you back involved. I'd ask, are there any questions or Points of discussion from members before I act on the action item as proposed by Amber.
So Justice Goff, I have one question for Mimi, and this is probably Mimi as a result of some of the previous conversations you and I have had about the proposal as reviewed by the EBDM work group is fairly high level. So we probably would need to, after JRAC weighs in on whether to move forward with it, I think the work group would need to be engaged and involved with you to kind of develop the next steps. Is that correct? Some concrete steps and really flesh out the timeline and activities. Is that correct?
Yeah, absolutely. I felt like it wasn't doing justice to Indiana or the work to try to conceptualize that independent of conversation with the committee members. So I would definitely appreciate that opportunity.
Thank you.
Thank you, Mary Kay. Anyone else?
Justice Goff, if I could say something briefly about Mimi and her team. I was involved in pretrial pilot county through Monroe County, and CEPP provided technical assistance for our county, getting us moving forward in that direction. And I gotta tell you, her team providing that assistance was invaluable and helped us move forward tremendously with our pretrial project. And, I truly believe that her organization will be able to do the same for many of our local JRACs across the state.
Troy, thank you for that excellent perspective. Anyone else?
Justice Goff, I just echo kind of what Troy said. I've been working with Mimi through the EBDM stuff for, I think, nearly the whole 12 years that it's been going on. And to have the assistance that can be developed to kind of prompt the local organizations to move forward, give them some guidance, challenge them to do what they need to do. It's the interesting thing is you may have all of the personnel and expertise and things like that in the room to move the projects forward that you're working on in EBDM, but just kind of getting a structure to move forward is so important in the process. And so having technical assistance to help facilitate that part of it, I think is really invaluable. And like Troy says, that kind of makes or breaks whether you're actually accomplishing, things. And so, I think Mimi's really good at her job, and I would certainly encourage that we move forward with it.
Thank you, Judge. Excellent. Anyone else? Well, Mimi, I'm so excited that you are back working with Indiana. I can't tell you how humbling it is to be part of this group. I'm sort of a longtime listener, first-time caller when it comes to this. I was never a part of a pilot county, but from up the road, I looked in awe sometimes at what was happening with pilot counties. Judge Spitzer was one county to my south, and we tried to implement a lot of those practices in my little neck of the woods, and really saw the benefits of that. So terribly excited about having a mechanism by which we can build an infrastructure that's going to work for all of Indiana to really deliver the goods to the folks who most need them. And we look forward, and we're so appreciative of your expertise in that regard. So not to lead the question then, but I guess I would call for the question. All those in favor then of having Mimi and her organization involvement with our technical assistance and our other work with the local JRACs and continued work to develop EBDM through JRAC. It's 2 items. I'm calling for one vote unless you want me to split it up. Please indicate by saying aye.
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 Any opposed? For purpose of record, if anybody needs to abstain from that, and you want to indicate that, please go ahead and indicate now. All right. Very well. So Mimi, again, on behalf of my colleagues on the Supreme Court and all of our constituent members of the Justice Reinvestment Advisory Council, thank you for your work, and we look forward to collaboration to make things better here in Indiana.
Thank you, Council. I'm really excited about the future of this work in Indiana. Appreciate it.
Thank you. Well, I'm going to go ahead and move on then in our agenda to item number 4.
Excuse me, Justice.
Yeah.
Hi, sorry to interrupt, Justice.
No,
This is
please, Chris, go
Nader.
ahead. Didn't mean
Yeah,
to cut
on
off the
the
discussion.
No, thank you. Yeah, it's on the EBDM topic. I'm wondering with respect to the local JRAC legislation, whether it would be helpful for us to get a consistent description out to our local partners. You know, the local JRAC statute impacts a huge number of people, we all know, in the various aspects of the system. And so, you know, we know we're working on it. We've got Mimi lined up to help with those resources, but you know, just to help people understand, you know, what this means, what it doesn't mean, and just so we have a consistent description among our various partners. I just wonder if we should think about that.
Yeah, Chris, thank you for bringing that point up, and I think the answer is a resounding yes. Part of our discussion last week with a smaller group that was looking at these criminal community corrections code revisions, that's also part of the statute, was that we're going to be required to submit a report at the end of the year. And along with that report, there was thought that there would probably be sort of a thumbnail sketch, sort of a brief discussion of what the local JRACs would entail. And so my thought was, with bringing Mimi in and that work, that was going to come, but I certainly wouldn't see any downside if we wanted to craft something separate and apart from that. It was sort of all encompassing, maybe in advance of that. Certainly got enough people that have been doing this for a while that we could probably come up with some language everybody would agree on, but I think that would be an excellent idea.
Justice Goff, may I add something?
Please, yeah.
So I think Chris's point is well taken. Our office has received a couple of inquiries about what their options are, what their obligations are under the new statutes. And I think it would be really helpful for, as Amber suggested, for that work group to continue in the capacity to support Mimi's involvement in this project. And I think when we worked with Mimi on the proposal, one of the, probably outlined at a higher level, but one of the high priorities is to really articulate to the counties what this means for them. And not only what it means for them, what their obligations are, but how they could go about doing this work, again, from a high level, and then what assistance would be available. So I would propose, or perhaps make a motion, that the EBDM work group be tasked with this relatively quickly, just to get that information out to the local jurisdictions as soon as possible.
Yeah. Anyone opposed to that? I'm not hearing anyone, and again, Chris, thank you for bringing that up. And Mary Kay, I think, at least from my perspective, that'd be the most appropriate and probably the most efficient way to get that done. So certainly time frame looked like we could certainly have some language, hopefully, that we could vote on by maybe the next meeting. Would that be acceptable to everyone, or August? So we got about 2 months to come something. Is that too late?
Well,
Okay.
Justice Goff, I think that the next work group meeting is June the 16th.
Mhm.
And so perhaps we could, by email, get an update from the work group to see where they're at, to see if, if there's consensus in the work group. I don't know that what should go out fairly quickly needs to be really, really in depth. I think it can be pretty high level, as Chris suggested, just to either preempt some questions or to try to address some of the questions that we're getting. And then the work group, as part of the bigger plan, can do some more extensive work with Mimi. Truthfully, with Mimi, we have to work through her contract. Her contract will go through our office. It's going to take a little bit of time to get some of that put in place. And so it could be that the work group can put together some high level messaging that we could circulate via email among this group, just so we can get something out. And then we can talk about the distribution method. You know, for example, we have our Wednesday message to the courts and probation officers and things like that. And that way, even though this section of the statute was, or it's effective July 1st, you know, we're going to be getting some questions pretty quickly, as I'm sure other work groups are, or our constituents groups are.
I think that makes sense. So if there's no objections, no further discussion, then we'll look for some language circulated via email, and we'll get some directives out sooner rather than later. And appreciate that. Anything else before I move on in the agenda? Anything else with respect to EBDM? Again, thank you, Chris.
No, thank you, Justice. Thank you, Mary Kay.
Okay. So for agenda item 4, 988 and crisis response, Indiana's transformational opportunities. Jay Chaudhry has requested this as an agenda item. And at Jay's request and invitation, I'm pleased to introduce and welcome Dr. Chris Drapeau, the State Suicide Prevention Director with the Division of Mental Health and Addiction, to share the important work being undertaken around crisis response. So thank you, Jay, for inviting Dr. Drapeau, and thank you, Dr. Drapeau, for your presentation. So please feel free to take it away.
Thanks, Justice Goff. I'm actually going to really just set the scene and then turn it over to Chris really quickly.
Sure.
I just wanted to emphasize for the benefit of the group that, you know, I chose that title for this presentation non-hyperbolically. Like, we really do stand on the cusp of a transformational opportunity that's going to affect each and every person on this call. And you know, I would just, you know, we're super excited. Everything's lining up really well. We have, I think, some funding identified to help build this system up. But what we really need now is I think, buy-in from all corners of the state, and you know, help identifying local and community stakeholders that we can bring to the table to help us do this, because this will not be a top-down thing. As you'll see, it's going to be a very much a hyper-local approach that's going to be held together by the infrastructure that we're building and creating. So, you know, with that, I'll turn it over to Chris, and I'll say that one of the serendipitous things that happened with this was we were able to bring Chris on board last summer, right in advance of the 988 legislation being signed, and he's just done a fantastic job of bringing everybody together. So I'll turn it over to Chris.
Okay, so I'm assuming the slides can be seen. So look okay?
Yes. We can see them, yes.
All right, well, thank you, Jay, Justice Goff, members of JRAC. I appreciate the time. And so I'm going to try to be brief just to make sure that there's time for questions and answers. So if you want more details, we'll be happy to get those to you. But really, as Jay was pointing out, this is a transformational opportunity. Really, a lot of people on the national level are calling this a once-in-a-career opportunity, given what 988 is providing us with, and the opportunity it's providing us with. And so just really quickly, if this 3-digit number sounds new to you, the National Suicide Prevention Lifeline number is currently a 10-digit number. And we have 3 National Suicide Prevention Lifeline centers in Indiana. And of course, there are many across the country. Well, it's this 10-digit number, which is going to be condensed into this 3-digit 988 by July 16th of 2022. And so because of this, you know, the federal government is expecting every state to figure out how we will prepare for what's expected to be a significant increase in calls, chats, and text messages to this new 988 number. And we're looking at, I think currently we get maybe around 35,000 calls to our NSPL centers in Indiana. Well, it's expected this could jump up to 200,000 calls in the first year alone. So this is just what we're up against. But I still want to show you here, kind of we rolled out a new infrastructure for our state suicide prevention efforts and a new vision. And this encapsulates what we're thinking with 988 as well. We're trying to be more collaborative, to understand who's doing what role do people have, how do we hold ourselves accountable, and how do we sustain these efforts so they don't disappear once things get tough, especially with funding. But making sure we're taking the national best practices, feeding that into our state infrastructure, but also going into our local communities so that we understand the realities that they faced, so we can build a system that they will trust. that they will rely on. So that's another thing that we're trying to push toward. And I think many of you are already doing this in your respective areas. So here's the vision. Before it was, let's just stop suicides, let's reduce the number, let's focus on zero. We think we need to go bigger than that, which is focusing on quality of life. Because what this does is the potential to stop or prevent suicides, but also address the reasons why people are becoming suicidal to begin with. So we're hoping that it will tackle two things at once, lowering the numbers of suicides, but also helping people build higher quality lives. And we think that this is an essential component as well of much of the work that you do, and also the work that we're trying to do with this 90-day planning, which you're going to see more as we go throughout this presentation. So in January, DMHA received a grant through Vibrant Emotional Health, which is the parent company of the National Suicide Prevention Lifeline. They're administering that lifeline. And so it's a very quick period. As you can see here, it ends in September, but it tasks us with trying to figure out how we're going to build this infrastructure and sustain it over the long term. Next slide. So here's a timeline of where we're at. In our next, we have a 988 Implementation Coalition meeting, which some of you are members of. If you're interested in joining, it's an open group. You're more than welcome to join us if you want to be a part of this conversation. And this is the timeline that we're on. So the countdown date is based on our next coalition meeting, which is on Tuesday, June 8th. So we've got 403 days to get this ready to go. And we've looked at a lot of the different models that exist in the state for hotlines. We've talked to the child abuse hotline. We've talked to 211. We've learned about our 911 infrastructure, our current National Suicide Prevention Lifeline Center infrastructure, just trying to understand what's going to work best for us as we look at these significant increases in volumes that we're going to see. And so now we're getting in the process where we have this proposed infrastructure, but now we have to figure out what are those key questions, those potholes that we need to make sure are filled in before we hit the go button and go live with this. So this is an idea of where we're headed, and we have to submit reports based on how we're going to approach this to SAMHSA and Vibrant, so that they are up to date on what we plan to do in the state and can provide us some guidance if necessary. But this is what we're thinking for our vision for 988. We're not thinking about 988 as just another program, but really its own entity, something that could transform crisis care across the state of Indiana and permanently. So the vision is focused on quick, competent, and nation-leading crisis responses. And this isn't really an ego trip when we say nation-leading, but rather trying to ensure that Indiana residents get the best of the best, because we know if we are leading the nation, that's very, very likely the case. Also, we want to make sure that we are trying to address using those best practice approaches. So if you see in parentheses for the mission, we're trying to adopt the SAMHSA adopted Crisis Now model, which if you look at this next portion of the slide, the Crisis Now model section, really it focuses on three things: someone to talk to, someone to respond, and a place to go. So our future 988 center or centers will be that someone to talk to. If that level of care does not resolve the crisis, the next step would be dispatching mobile crisis teams, which would be someone to respond. And if that doesn't work, the next level of care would be crisis receiving facilities. So 23-hour facilities, not as intense as an inpatient hospitalization, but specifically focused on crisis de-escalation and allowing people more autonomy than an inpatient unit might provide. But also making sure we have this recovery attitude, and that we we make sure that peer support is a significant part of this system, because we know that some people are hesitant to reach out to professionals, but more likely to disclose to a peer and feel safer doing so. And especially if that peer has lived experience, they've been through the crisis system, they know what to expect, that can provide some certainty to an uncertain situation. So we think that peers are a pivotal point or part of this process. And here's kind of a snapshot of what it could look like. And what this slide is showing you is that the majority of crises are actually resolved at the crisis center level. And then as you go further down, you see the percentages decrease a bit. But what I want to emphasize here is if you see the 911 and the police vehicles, what this is referring to is that 911 would divert their mental health, suicidal, substance use crises that typically reach out to them. They would divert those calls to 988. Law enforcement also could divert some of the response to the mobile crisis teams, and also could link people to crisis facilities, instead of emergency rooms and jails and prisons. Now, we see this as really a radical collaboration with law enforcement. We see this as a team effort. We're not trying to take work away from law enforcement, but rather free them up to do other things, because based on conversations that we've been having with law enforcement officers, even fire and EMS, is that mental health calls are taking up a significant portion of their time. These calls don't just take minutes, they can take hours, and sometimes they have to transport them long distances. And so it's trying to figure out, how do we team up with law enforcement to ensure that they have the resources they need, and how can mobile crisis teams in our call centers and these crisis receiving facilities be a resource for them and provide additional options, so we don't have to send people to jails and prisons or the ED, which can be very costly. So really, it's about freeing up time for law enforcement and also saving costs across the board, not just for the state, but also for those who are in crisis and reaching out. So this is something that we're really excited about, and making sure that we are on the same page across the state, as Jay was mentioning. So we have a number of law enforcement professionals on our coalition, but we're always eager to add more people. So if you know anyone who'd like to be involved and provide that pivotal perspective of what it's like to respond to crises in the local community, we would love to talk with them so that we can make sure that we're thinking through as thoroughly as possible. Because one thing you might be thinking is, okay, what does mobile crisis do if there's a threat to public safety? Well, I know some states like Georgia, they've come up with triage levels to know when do we pull in law enforcement and when can mobile crisis respond without them. And so that's a key task for our 988 coalition to figure out, and we'll have to break into work groups to do that moving forward. But just to let you know, that we're really focused on collaboration and making sure we're working together as a team. Here's some of the technology that we're hoping to implement. I'm not going to read the slide to you, but all of you will receive it so you can read it in more detail on your own time if you would like. But essentially, we're trying to ensure that we have the most advanced technology, so that, for instance, if we dispatch mobile crisis, we have GPS-enabled technology so we can track where they are, know where other mobile crisis teams are to respond, or provide that information, that geolocation information, to law enforcement in case they do need that backup support. And also ensuring that we can connect those who reach out to outpatient appointments, because we know, based on research and anecdotal reports in our own state, that some of the high risk periods for a death by suicide is in the discharge period following, the transition period following discharge from inpatient units and emergency departments. That's a key time. And what's one way to reduce that risk? By following up with those individuals and making sure they're connected with quick outpatient care. And so part of the system, we would be able to provide that through our 988 centers. They would work with mobile crisis teams to make sure that that outpatient appointment is scheduled for them. So that's just some of the technology we're looking at there. And here's kind of the structure we're proposing to implement in the state. So similar to 911, we have a statewide 988 board that provides oversight for the entire system. Currently, we're leaning toward just having one statewide 988 center, and then looking into expanding into satellite centers in the future once we have the resources and know-how of how to do this well. But this is kind of where we're leaning with one statewide center, after talking with other partners at the Child Abuse Hotline and 211, who started more regionally and then eventually went back to statewide. So we want to start with statewide and see if it makes sense to expand from there. So the calls obviously would be routed into the 988 center or the satellite center if that's part of the infrastructure. That center would then dispatch mobile crisis if it was determined that that level of care was necessary. But this is kind of rehashing things I said in the previous slide, so I won't go into extreme detail here. But we think there's some pros and cons of the system, having this kind of network for 988. Number one, it kind of sets up a chain of command so that everybody's kind of working together. And as you know, people in crisis, they really need consistency in response. They need to know what to expect if we really want them to trust reaching out to us. So ensuring that operational consistency across the entire network is pivotal. And having that main center and that statewide board, and then it all kind of feeds into one another, can assure that we're all using the same standards and approaches across the entire system. We also know that centralizing the most advanced technologies at that main center, it cuts costs. And when you have those satellite centers, kind of like a hospital campus, those satellite centers feed into the main center, you're also reducing the need to build infrastructure at each of those independent centers, which also will save costs in the end. So it creates greater efficiency. Also, we want to make sure that if there is excellence, when we obtain excellence at the main center, that is kind of reverberated throughout the entire system. This is assuming, of course, that we have satellite centers. So I apologize if this is a little confusing going into this detail, but this is just kind of looking at some of the benefits if we use this kind of hospital campus model to building this 988 network. Okay, so like I said, this information will be available to you to review, just kind of the pros and cons of the system. But one thing I want to emphasize is that we really need to make sure that we're getting the community reaction to 988, because what I'm learning is a lot of people have no idea what this is and what it's going to mean for them. And so we want to create a focus group, a community focus group that, you know, we would be happy to travel to any area of the state, say Evansville, any part of the state, just to listen to the community concerns about reaching out to suicide prevention hotlines and the like. What would it take for you to trust this system? How can you depend on it? Because I think that information is really the meat that will help us build this into something that will be truly valued and provide a safety net to empower people when they feel like they're at a moment when they have nothing left to live for, or they feel like they cannot cope with some of the, you know, traumatic or acute stressors that they may be facing. So that's another thing that we're thinking about creating. And if you have any contacts, or if you want to assist us in building these community focus groups, we really need your help with that, because we want to make sure we capture those significant concerns. So I'm going to stop here and take any questions that exist, but I appreciate your time and really am excited about this effort in Indiana.
Well, Dr. Drapeau, thank you for that excellent presentation. Are there any questions for Dr. Drapeau from any of the JRAC members?
I had a question. This is David Bauer from the Association of Counties. It sounds like you're covering this, but you are in good communication with the state 911 board and their executive director, Ed Reuter.
Yeah, we've actually had conversations with Ed Ryder even before this coalition was created. So he's been on board the entire time, and we were fortunate enough to tour the Hamilton County 911 Communications Center with Ed a couple weeks ago to look at their technology and how do we make 988 and 911 interoperable. So that's definitely a key conversation we're having.
Excellent.
Yeah, question.
Yes, please.
Do you have statistics or demographics showing where the calls are, you know, the suicide rates or the suicide numbers, and where the calls are across the state?
Yeah, we can compile that too if you'd like an updated account. Unfortunately, I've been told by the Indiana Department of Health that 2020 data hasn't been finalized yet, so we don't have final numbers there. But I can tell you the calls typically call from our most metropolitan areas of the state. So if we broke it down per population, I'd be curious to see which counties had the highest rate of calls. But I can tell you 13 to 24-year-olds are the most frequent callers every month. And that the most recent data that I have is for April of 2021. And that is the highest calls received month for the suicide prevention hotlines going back into February 2019. So suicide rates, I'd have to analyze that to see if anything's changed over the years. But I know like counties around Jefferson County, I don't know if you saw, there's a recent report released by the National Mental Health Association group. They're looking at suicide ideation across the United States, and there are a few counties in Indiana that were in the top 20, and you know, I think there was a few around Jefferson County, so that area of the state tends to have a higher rate of suicide ideation and rates, I believe.
Okay, thank you.
Thank you, Senator. Anyone else?
Justice Goff?
I'm sorry.
Yes, Mary Kay.
So Dr. Drapeau, thank you for your presentation. I'm with the Office of Court Services. My name is Mary Kay Hudson, and our office, along with a lot of other partners on this call, do a lot of education for various groups in the criminal justice community. And I just was curious if at some point, either you or a member of this team would be open to presenting at some of our conferences, or otherwise coming to meetings to help educate our groups about this resource as it becomes available. Would you be able or willing to do that?
I'm definitely interested in especially if we could talk about how can we best collaborate to ensure that we're on the same page and being most efficient. Would be of great interest as well.
We have a couple members of our team who work really closely with community supervision agencies and judicial officers on continuing education. So I suspect a member of our team will be reaching out to you soon. Thank you.
As Chris's boss, I will say he can go anywhere at any time and should. So
Was there anyone else that had any questions for Dr. Rapeau?
I did, Justice Goff. It's Dr. Mark Spitzer. I'm a judge in Grant County and also have a vet court and a drug court here. I heard you mention, I thought I heard a mention of substance abuse or use or dependency. And I was just interested to know to what extent, it seems like the focus here is suicide, but I wanted to know to what extent that there's some interface between that and sort of overdoses and the addictions crisis that we have.
Yeah, I can tell you nationally, this 988 number is being advertised as focused on mental health, suicidal crises, but also substance use. But I think that's a task for our 988 coalition. I'm excited that Mr. Hunsinger will be joining us as well as other leaders in the substance use area. So we can define who do we refer to 988? Because I can tell you most of the calls that go to our suicide prevention hotline, the primary concern isn't always suicide. Sometimes it's general mental health. And so I think the national group has noticed that. And so they're promoting 988 as more of a general mental health line. Of course, suicidal crises are a focus too. So that's something we need to clarify, because I know there's a lot of hotlines that exist in Indiana and the public needs to know who to call and when. So that's one of our focuses as well for the coalition.
And Judge Spitzer, our intention is as much as possible to have this be a comprehensive behavioral health focused. So SUD, mental health, suicide, kind of all one-stop shop. But that's, planning that needs to is occurring now and needs to continue. So.
Okay, that's good to know. Thanks, Jay.
Dr. Rapeau, Chief Justice Rush and I have been working with the National Center for State Courts and its task force to improve court and community response to mental health and co-occurring disorders. And Indiana has, unfortunately, a lack of intercept zero, deflection points for folks who are in crisis. And this is going to be an excellent tool for folks like that. It takes a while to get the word out, as you and Jay, I think, recognize, but we are going to host a statewide summit. We're going to invite multidisciplinary teams from all 92 counties in the fall of next year, 2022. And I think that that would probably certainly provide you an excellent opportunity to get the word out to a broad swath of all of our communities. So wonderful work. Thank you very much for what you're doing to make Indiana better. And thank you for sharing that with us today.
Yeah, thank you for the time. And thank you, Jay, for recommending this.
Anyone else before we let the doctor go? All right. Thank you again, sir. Agenda item 5, coronavirus state and local fiscal recovery funds. I believe that there's a link to a website on your agenda. And I'm just going to share with the group that a small group of us met last week regarding, it's really exciting and once in a lifetime probably opportunity for direct allocations from the U.S. Department of Treasury to counties throughout the nation as part of the coronavirus state and local fiscal recovery funds. The intent of these funds is to provide eligible state, local, territorial, and tribal governments with a substantial infusion of resources to meet pandemic response need, and also rebuild a stronger and more equitable economy as the country recovers. And for this agenda item, I'm going to call on our partner Dave Bottorff to provide some additional information regarding this resource. David, good afternoon. David, are you able to hear me?
He's still muted.
Okay.
There, hopefully you can hear me now.
Yeah, there we go. Thank you.
Yeah, so Justice Goff or the team also attached a written document from NACO, the National Association of Counties, that gives a nice brief outline of how the money can be spent. And of course, we've talked a little bit about this before, but there'll be 2 installments coming to Indiana counties. Every county is eligible for the money. It's 1.3 billion with a B. It'll be paid in over the next 2 years. Several counties have signed up and received their first installment. The statute is it's the county commissioners who create the plan. So it's going to be their recommendation, or not even their recommendation, that they'll adopt it really through an ordinance on how the money will be spent. I know we've talked about this with several groups, but I would encourage people on this call, this team, your local teams, to get together and approach the commissioners about how this money could be spent for criminal justice. And there's a great deal of flexibility in it for opioid and mental health issues. So some of the money is used for loss of revenue due to the pandemic, and there's a formula that the county can use to recover that. Any money that's recovered through the loss of revenue mechanism can be spent on any government purpose. So that provides a lot of flexibility, but there is a formula the county will have to go through to use that. But the other thing that we've been working on with our national association, and they've asked U.S. Treasury for some guidance on this, is if the money could be used to, last year we the courts didn't have a lot of jury trials, and the court system was slowed down, so there could be a backlog. If this money could be used to hire, additional temporary, public defenders or prosecutors, or pay for senior judges or something like that, so that we can remove the backlog. That hasn't been determined yet by Treasury, but to me, it seems like it would be a good use for the money. Again, we just continue to get updates from our national association that the final rule won't be out until mid-July on how the money can be spent. But it is really an exciting opportunity, and this money is quite a bit different from the CARES Act money. CARES Act really responded to the healthcare crisis, and this money is really meant to, I would say, change the community going forward. To have a community or a county that's better equipped post-pandemic than they were pre-pandemic. So it's really exciting, and we're working up a system where we can track how the counties are going to spend the money, ask them to report to us, because I'm sure the public wants to know how the money is going to be spent, and members of the General Assembly are going to know how the money will be spent. So it's really a fantastic opportunity, and I'll continue to send information to Justice Goff and his staff, and they can share it with the group. But it's really exciting, and again, I'd be happy to answer any questions anyone may have about the program. Senator Italian, yeah.
Yeah, David, has your organization sent this information out to all the counties?
Yeah, we've sent
To
this
all your members?
Yeah, we've sent this information out, videos. We've been sending videos on a pretty consistent basis since late March, early April, as soon as the legislation passed. So if your counties are calling you saying, we're not sure how to spend the money, let us know. I mean, we've worked with the county auditors to make sure they had all the DUNS numbers and that they've signed up for the program. Again, not every county's received their first installment yet, but they're certainly eligible. And if they have any questions, they can contact us. There are some counties who are a little bit concerned, until the final rules come out by Treasury, they may not spend the money yet because they want to see that. Because the last thing you want to do is spend the money and then find out.
Have to give it back.
Yeah.
Yeah.
Yeah. So, but as you know, I've sent some information to your staff yesterday, Susan Bremel, some videos and the same document to share with the caucus if she wants to. But yeah, if you're getting questions from people who act like they don't have the resources, have them contact us and we'll put them in touch with these videos.
Well, just unfortunately, what I'm mostly getting contact from is small towns.
Yeah, okay.
On what they're allowed to use. So, but I haven't heard anything from the county, so I guess that's good news.
Well, the small towns, there's a different process for them to get the money. It goes through the state, so it's a little bit more complicated, where the county's the direct recipient. Yeah.
Anyone else have any questions for David?
Justice Goff, I have a question, if I may.
Please, Troy.
David, I was reading through some of the materials that were sent, and I'm interested in the lost revenue aspect. And I read through kind of the formula of calculating that. But one of the things I came across, and please correct me if I'm wrong, it said that it needs to be calculated on a government-wide basis or an entity-wide basis. And I'm a little concerned about how that might affect some non-reverting funds, or for many of us in criminal justice, our user fee funds, and whether or not that money could be used to help replace any lost revenue in some of those user fee funds, and not just the general fund for the county.
That's a great question, Troy. And we've actually talked about that through our National Association with U.S. Treasury. It's a little bit, but I think the reason they failed the way they did was just from a simplistic standpoint. You know, they're trying to track money all across the country, cities, towns, and counties. So I think they came up with the formula on the countywide basis. But we still think that some of the money, especially when it comes to like court fees, the funds that receive court fees, we think there may be a way that we can backfill that as a possibility. But again, as of now, it's on a countywide budget basis, and it's not perfect. I mean, you just can't expect a national piece of legislation to be perfect. But yeah, we've identified some of those issues as well. We're asking for that clarification, but I don't have a good feeling that they're going to allow us to break it down by fund, because there are other funds that were down last year as well. But overall, you know, the budgets turned out much better than we expected last March and April. I'll just say that. Income tax collections were better than expected. MBH money came back better than expected. There are a lot of counties, definitely food and beverage tax was down for a while, but it came back as well. So just really complicated when you get into each units of government's fund allocation. So I think as of now, we're going to have to deal with the countywide number. But if there's a way for us to backfill those funds, we definitely want to do that.
Excellent.
Dave, Judge Spitzer, is there a certain amount of funds, potential funds that are allocated to each county by population, or I guess how is that determined? Question one. And then question two, if that's the case, then sort of are we as sort of the justice system part of our county in competition with other parts of our county to access those funds?
Yeah. Yes, I can send the link to how much each county is going to receive in direct allocation. And again, yes, so internally, you need to make a case to the commissioners about how the money could be spent. And maybe it's, again, increasing technology. Again, there's a lot of flexibility with mental health and addiction services. But again, I think it would be better if for the justice partners went as a team to the commissioners that included, prosecutor, judge, public defender, sheriff, community corrections, probation, and just said, overall, this is a way for us to assist our citizens, because you are going to be competing against, other projects the county may use it for, but initially the county cannot use it for roads or bridges. They can use the recovery, but the lost revenue that they identify can be used for those purposes, but that's not something they can do up front. The infrastructure aspect of the bill is it can be used for broadband build out, infrastructure, broadband build out, roads and sewers. At the moment, it can't be used by statute for bridges and roads.
Do I recall there was an August date where, or it's up, that you sort of identify how you're using the funds, or somewhere?
That's just initially. So the funds have to be dedicated, I'll say, by December of 2024. They don't actually have to be spent now until December of 2026, from what we've learned from the guidance. It's right here on the screen there. You can see December 31st, 2024, funds must be incurred and obligated, and then they don't have to be spent to the end of 2026. which gives us a little bit more time. But no, the county will continue to update their plan as they identify the needs. So we've also encouraged counties to create an advisory committee. We would encourage the commissioners to create an advisory committee that would include, a multitude of leaders, including nonprofits, townships, anybody who would give relief to citizens who are having a difficult time, making it because of the downturn in the economy, or maybe they lost their job. So we're seeing that a lot. We're getting lots of reports that counties are creating those types of committees. And again, maybe perfect time for the local JRACs to be created, because they could go to the commissioners and say that, the JRAC organization or group has identified these as some resources. It can also be used for sort of essential worker pay, and that's outlined in the document that was provided. So we've talked to the sheriffs about, jailers are a big issue, trying to keep them in the county. Their pay is historically been low, and we've had a lot of turnover with the jailer. So that may be something that the sheriffs would want to approach the commissioners about. And again, this is temporary money, so you don't want to build a cliff. You want to build a bridge with this money, but definitely something that the commissioners could consider, sort of the back pay or the premium pay.
Great. And anything else from our members? Well, really appreciate David's work on behalf of the state, and selfishly on behalf of our justice system. He's been a dedicated member of our informal justice partners calls throughout the duration of the pandemic. And when word reached us that this money was going to be coming into the state, David was just really Johnny on the spot in keeping us informed as to the particulars. And I really appreciate the opportunity to review the materials that he sent along and really glean some basic understanding of how they can be used by our counties to really provide, probably once in a lifetime, as I think has been said, improvements to our criminal justice system. As in Judge Spitzer, you guys have been early in forming your local JRAC, but David is right. He's observed more than once that as these organizations, these groups are coming online, my hope is that, your group, and as we talk to Mimi about providing technical assistance, we include a piece of that, really just some indication to our county partners that this money is there. It can be used, as he said, for some back pay, but also mental health and addiction, also broadband as infrastructure and things like that could really help improve efficiencies in the criminal justice system. So really opportunities for collaboration here and to make things better for folks that we really probably didn't think we'd ever realize. So anything else, David?
No, that's it. Thank you for sharing that document. And again, anything I can do to help out. We have talked about maybe doing a video with some of the justice partners about this revenue being available, and maybe again offering some, I'll call best practices as far as approaching the county commissioners on how this money could be spent for criminal justice.
Thank you for reminding me of that. And that I think goes to Chris's point earlier when he was asking about some just sort of guidance. We've had so many conversations in such short order about the local JRACs coming online that I'm confident that we've got some really good ideas that we're going to be able to package and really help give some folks some good guidance about this. And David's work is certainly a huge part of that. So thank you again, sir, for everything that you're doing, and look forward to continued service with you.
Thanks.
If there's nothing else with respect to agenda item 5 and our coronavirus fiscal recovery funds, I'm going to move on to agenda item 6, which is our JRAC data sharing MOU. And for that agenda item, I'd ask for a report out from Mary Kay Hudson.
Thank you, Justice Goff. At the last meeting, I had mentioned that the data sharing MOU that was previously executed by the state EBDM team and JRAC with the idea of being able to integrate various data sources for the purposes of working on projects and doing research. That had, it was out of date and needed to be reviewed and revisited and possibly re-executed. Since then, Michelle Goodman and I met with Devin McDonald and had a conversation about that. I think there are some ongoing discussions with CJI and some data issues, data sharing issues that I think we just need to hold off on any update or re-execution of this pending the outcome of some of those conversations. And so I don't know if Devin has any additional information to add to that, but just we will touch base with JRAC when we have more information.
Yeah, no, thank you, Mary Kay. I don't have any updates right now. Some of those discussions are ongoing right now, so I'll hopefully have a little more information about the next coming week or two, so we can address that. But part of the discussion relayed around our work on this victim notification system and the fact that CJI will then become the data stewards, owners of a pretty substantial amount of criminal justice related data that could impact how the MOU actually functioned and worked. So I reached out to Michelle and Mary Kay and wanted to initiate the conversation to say that it may kind of, you know, as I said, impact how we do the MOU moving forward, just because of the amount of data that will be under our control and be able to move back and forth. So a little more to come on that, but that's kind of, as Mary Kay alluded to, kind of the reason why we wanted to hold off on that. And once I have some of my pieces in place, then we should be able to inform everybody else moving forward and then get this MOU addressed.
Very well. Any questions from members of JRAC for Mary Kay and Devin? Well, hearing none, Mary Kay and Devin, thank you for that update, and we'll look forward to hearing more from you as conditions develop. So, thank you. We are now at agenda item 7, which is that time in our meeting when we call for report outs from member organizations. And during this part of the meeting, I always call on member organizations in the order in which they appear in the statute. I'm going to do that today. I note that in the chat, I've received some correspondence from various members that they're having to attend multiple meetings right now. And so if I should call on someone they're not here, I'll try and circle back as soon as I can. But first, I would ask for a report out from Bernice Corley on behalf of the Public Defender Council. Hello, Bernice.
Hello, thank you, Justice Goff. In recent weeks, the council has begun working with the Department of Education. We've been working collaboratively. As many of you know, public defenders obviously represent juveniles in delinquency matters or juveniles that get waived into adult court. And we've run into situations where attorneys don't really know how to advocate for educational resources for those children while they're in the system, so to speak. And so we reached out to DOE to try to better understand what resources are available and what we can better do to equip our attorneys and social workers to be able to work with these children and make sure that they're not missing their educational services that they're entitled to and that they need to grow. So we are actually entering into MOU, and we will be partnering to provide technical support to attorneys as well as training programs. So that's really exciting. And then we're also working with DCS. We've been providing multidisciplinary trainings with DCS attorneys and staff and public defenders and social workers, et cetera. And that's been really successful and really well received by all the attendees. And then finally, we've been hosting a training series on trauma and how to work with people who have been traumatized and find themselves in the criminal justice system. So the partnership has been with DMHA, DCS, and we've had over 500 attendees at our first event, and represented in that 500 were court staff, judges, legislators, people who work at DOC, PDs, et cetera. So that's been really successful as well. So those are my updates.
Well, thank you for that, Bernice. You have certainly been busy over there. Are there any questions from JRAC members? Great. Next call then for a report out on behalf of the Indiana Prosecuting Attorneys Council from Chris Naylor. Hello, Chris.
Good afternoon, Justice Goff. Thank you. IPAC is in the midst of training season for our prosecutors. A couple weeks ago, we had our annual spring seminar. One of the interesting topics that day, we had a couple of our seasoned prosecutors talk about trying cases in the time of a pandemic and how working with their local judges and local counsel to make for a safe environment with spacing, some of the unique challenges that provides, and interacting with jurors. And then also, protecting victim witnesses and child witnesses from the live streaming. So a really interesting discussion. Next week, we have a very large annual child support conference. Then the following week, we have our annual summer conference. And one of the items of interest for our summer conference is an EBDM roundtable of prosecutors from 4 different counties who've adopted EBDM principles and policies. And so it'll be good to hear from those prosecutors, and they're going to talk a little bit about how the pandemic affected their work and what were some lessons learned from the pandemic and some things that can be utilized moving forward. So it's a fun time of year, seeing lots of prosecutors through our training sessions.
Great. Thank you for that update, Chris. It has been nice to get back to live in-person training. So I'm glad to hear that, and thankful for the update. Are there any questions for Chris from JRAC members? Very well. I would next then call for a report out on behalf of the Division of Mental Health and Addiction from Jay Chaudhry.
Good afternoon. So you heard about 988, which is in crisis, which is a big focus for us right now. A couple other things I would say: we are sorting through the various buckets of funding we're receiving, both from the various stimulus packages as well as appropriated by the legislature, and then the upcoming opioid settlement. And we're kind of navigating right now how all of those funding sources interact with each other and kind of what the best way to maximize those are. So I guess, stay tuned. Probably at and maybe not the next meeting, but the meeting after, we'll I think be ready to have a more comprehensive presentation on that. I've already reached out to many of you about how to collaborate there. Only other thing, the increasing burden of competency restoration continues to be a problem for us, especially in the sense that we just cannot staff our state psychiatric hospitals. Workforce is a challenge everywhere. But when you have people that need one-on-one or two-on-one, not care, but just attention for staff, it becomes especially acute in the state psychiatric hospitals. So we're continuing to explore and look for creative ways to use the flexibilities granted by House Enrolled Act 1127 this past session to help offset that. So, again, making some slow progress, but COVID definitely, like everywhere else, threw our hospitals for a loop. But we're making our way back and looking forward to making some progress on that in the next year.
Thank you, Jay. Any questions from JRAC members for Jay? Once again, we appreciate your participation in the information, Jay. Thank you. Next call for a report out from Steve Luce on behalf of the Indiana Sheriff's Association.
Thank you, Justice Goff. A lot of things going on, but I just shortened my list to a few highlights. As David Bodorf has done, gave a great presentation. We had a call last week, monthly call with our sheriffs, and David was our guest, and he covered the ARP and the opioid lawsuit. And we really pushed out to our sheriffs to really, try and collaborate and do something locally, or even taking a regional approach with other counties. So hopefully they're engaged in conversation there. The jail data project is moving along. It was awarded to a Mosier Consulting. Aaron Garner is the project manager on that. He's with Mosier now, used to be with DOC. And that project is actually scheduled to be complete by October 1st. A lot of moving pieces still, but we are communicating daily on information and contacts that he needs. ISA, we are watching federal police legislation to see what's going to be going on in the Senate, and pretty engaged with our federal legislators on that, and keeping them update in good communication. Next week, we do have the 8th, 9th, and 10th, we're doing the Indiana Sheriff's Legislative Roundtable. So we will be in Fulton County. We will host one here at the ISA, and then we'll be down at French Lick. And hopefully we're getting really good numbers from our sheriffs, and we're getting quite a few legislators who are going to attend also. So we're looking forward to that. The only other thing, and I meant to say something when Bernice was talking about the racial equity group, we had a really good discussion this past week. And one of the topics was basically, data and identifying. We identified the live scan, which is a digital fingerprint machine that many years ago, state police kind of oversaw that. They were purchased through grant funds. And then in the last few years, there was no sustainable long-term plan for those machines. And it's very important to identifying offenders in Indiana and nationally or federally. But the one thing it does is to an offender in Indiana, the live scan, when they're booked in, they always retain the same number for an offender in Indiana, no matter what counties they're arrested in. So I'd like to have a discussion with JRAC a little further, maybe for the short session next year, something to where we can maybe create a sustainable grant program for counties, because basically I'm not throwing state police under the bus, but it was kind of transitioned over to the sheriffs to maintain those machines now. And what we don't want is 92 different fingerprint digital machines. So if we can continue that continuity of the same record keeping identifiers, and I think vendor, if we could invest in that with some state funds to help the sheriffs, I think that would be a very good investment long term. That's pretty much it.
This is Bernice. Steve, thank you so much for remembering that. And I second that idea very much. Not that this is an action time, but I totally agree.
Well, thank you to both of you. And I think we have Mimi still on the phone. One of the things that I think is important when we're talking about how to best utilize Mimi as we're spreading out this movement is, uniformity of data where possible and what we need to collect. So yeah, please do, both of you, follow up with that. And when we're a little less time constrained, love to have some information brought to this group, and then figure out how to best handle that concern. So I appreciate you bringing that to our attention.
Thank you.
Any questions for JRAC members for Steve? Well, Steve, once again, thank you to you and to ISA for your tireless work on behalf of the justice system, and your participation here today. I would next call then for a report out from the Indiana Department of Corrections, and call on Chris Blessinger. Hello, Chris.
Hi, thank you. So I'll be brief today. We just released the grant applications for community corrections. They are due back on July 9th, and then we're on track for executing out all of the amendments to continue services. So everything is going pretty smoothly at this point on that. We continue to give, vaccines to offenders. I know I don't have the actual numbers today, but I mean, we're giving them out at a pretty rapid rate. So that's going really, really well. We've got a lot of offenders that are taking the vaccine, which is great. I know we're getting lots of questions, so I just kind of wanted to give everybody an update today on what we're doing and when we plan to start back visits and volunteers back into our facilities. So I thought I would just kind of give an update that right now we're working on finalizing policies and what we're going to continue to do with that. So I'll keep everybody updated as to when we start doing that again. So I think that's all I got for today. Thanks.
Thank you, Chris. Any questions from JRAC members for Chris? Well, hearing none, Chris, once again, I appreciate the information and appreciate your participation and DOC's participation in our discussion on revision of the community corrections codes. Thank you very much.
Thank you.
Next call then for a report out on behalf of the Office of Judicial Administration from Mary Kay Hudson.
Thank you, Justice Goff. Just a couple of updates. We have been working with our fiscal office, and when I say we, I mean specifically Angie Hensley and staff from our fiscal office on distributing the grants for a lot of the programs that are kind of fall under the purview of JRAC, meaning pretrial and the family recovery courts, veterans treatment courts, other problem-solving court grants. So we're really excited about that. Getting those funds in the hands of the communities. We're continuing to field new inquiries surrounding pretrial and problem-solving courts, which is exciting. Our staff is getting back in the field to doing in-person visits for certification reviews. We are delving back into in-person training in the second half of 2021. So I think everybody's really excited about that. And then we do have a group that our office is assisting with staffing that's really led by the Indiana Council of Juvenile and Family Court Judges surrounding one of the provision in Senator Tallien's bill on juvenile justice, specifically the juvenile jail removal provision. Lots of questions and ideas about implementation of that aspect of the bill. Certainly everyone is supportive of that bill and knows that we need to do things differently with our kids rather than having them in adult facilities. But we need to work through some implementation issues. And so we've got a group that's really excited and dedicated on that. We've met once, we're going to be meeting again. Senator Tallien, we'd love to engage you in that or at least keep you up to date on that if you're interested, to see what some local solutions we may have. Some of the concerns are for communities that don't have detention centers, the finances associated with housing them out of county, potentially for longer periods of time. So we want to work with the jurisdictions to help them problem solve and develop some solutions around that. So those are the major things that we have going on, and I'm happy to answer any questions.
Thank you, Mary Kay. Any questions for Mary Kay? Well, again, Mary Kay, thanks for all you do on behalf of the judiciary and the state as a whole. Next call on Devin McDonald for a report out on behalf of the Indiana Criminal Justice Institute. Hello, Devin.
Hello, Justice Goff. Thank you very much. So again, I don't have much today either. I know it's been brought up a couple times now. The data project, the victim notification project, as Steve Luce alluded to, those are underway. We're currently talking about data points and everything that we want collected for those systems. As it is right now, it looks like we should be able to have a pretty robust set of data on a pretty aggressive timeline. So we're really looking forward to that. Other than that, there's not much else going on right now.
Thank you, Devin. Any questions for Devin? In that case, then I'd call on Amber Finnegan for a report out on behalf of the Association of Community Corrections Act Counties. Hello, Amber.
Hello, thank you, Justice Goff. We just completed our annual spring directors conference in French Lick, the middle of May. So we had a really good turnout with that. We had 115 attendees of directors and usually upper level management within various aspects of community supervision. We had a great workshop on servant leadership within our agencies, and it was just really great to see everybody and be in person, and then of course learning about servant leadership, which I have a passion for, so I thought that was really great. Chris Cunningham from Grant County also gave all the directors a presentation on the JRAC JRAC in House Enrolled Act 1068, and it provided just us to have kind of some question and answers and start people having conversations with their locals on how this was going to be implemented. So other than that, directors are busy writing out those grants that were just distributed. So the grant process this year is much easier than last year. So thank you, Chris, for doing that. It's a much easier process. And so we're just working on those grant applications and our collaboration plans. That's all I have.
Thank you, Amber. Do any JRAC members have questions for Amber? Well, in that case, Amber, thank you again for the report out, and thank you as well for your willingness to serve on the small group. Next call on Troy Hatfield for a report out on behalf of the Probation Officers Professional Association of Indiana. Hello, Troy.
Thank you. I don't have much to say either. I mean, we're focused on training in our fall conference. We're going to be in person this year, September 8th to the 10th at French Lick. If any member agencies of the JRAC board have some ideas for sessions or want to make any presentations to a pretty large number of probation officers from across the state, please get in touch with me. And Jay, I will take you up on that to try to get in touch with Dr. Drapeau about possibly doing a presentation on the 988 to our group in September.
Yeah, definitely. Just shoot me an email. We'll get it going.
Yep. All right. Thank you very much.
Any questions from JRAC members to Troy? Well, Troy, let me also say thank you to you for your willingness to lend your expertise to the small group. Looking forward to serving with you on that. And anything you need in terms of presentation to the probation officers, you just let me know. They're really the hands and feet of the justice system. So if we can help in any way, just feel free to let us know. Would next call on Kirsten Haney for a report out on behalf of the State Budget Agency.
So nothing too big to report on this end. SBA is just gearing up for fiscal year closeout and then also gearing up for the next biennium, making sure all of the appropriations are loaded and ready to go. We also just released the reserve memo for fiscal year 22 as well. And yeah, those are the major pieces. And I do want to say special thanks to David and Devin on this call. They've been incredibly supportive collaborators with trying to get some of the pieces geared up. You think back to the budget bill, there's some distribution of funding that's going to be going out to, and so they've been tremendous help in helping us to get all that put together. So just wanted to thank them for their help on that. But that's it on mine. Thanks.
Thank you, Kirsten. Any questions for Kirsten from JRAC members? Well, again, thank you for your participation, Kirsten, and thank you for the participation and collaboration of the State Budget Agency. A call again then on David Bator for any further report out on behalf of the Association of Indiana Counties.
Sure, thanks. And again, I really appreciate being part of this council. It's very educational for me. I think they're doing great work, and whoever thought of creating the local JRACs, the timing couldn't be more perfect, right? Because we have this money coming in from ARPA, opioid money, and then the additional money from the state budget. So this sort of collaboration that's going to happen at the local level couldn't have come at a better time, I don't think. So this report, we had our 6 district meetings post-session, and we had great turnout at all of them, average over 100 people at each one. So people are definitely anxious to get out and visit, and looking forward as we inch closer to the return to normalcy as far as social activities. So that's really all I had. And we do have a lot of information on our website, Association of Indiana Counties, National Association of Counties, and we have a lot of videos on our YouTube account that talk about ARPA money as well. So any information you need, slide decks or whatever, on those presentations, just let me know and I'll be happy to send them out.
Thank you, David. Any questions for David on behalf of from any of the JRAC members? Very well. I next then call for a report out from Judge Spitzer on behalf of the Indiana Judges Association.
Thank you, Justice Goff. similar report to, I think, some of the other partners. Our biggest thing that we're looking at now is that although we've certainly been open for business throughout the course of the pandemic, a lot of that was remote. And now as we get to more in person, we are able to do and catch up on some things that we need to, having not been in person. And so jury trials is certainly one of those things. And so I've had a couple within the last 3 weeks, and a lot of my colleagues have jury trials and report that they are going to be working through sort of the backlog of jury trials on both the criminal and the civil side moving forward. And so that's going to, I think, certainly impact a number of our other partners here, Chris Naylor and Bernice's constituencies, and Popeye and DOC, and even the Court of Appeals and Supreme Court, I think, are going to, so I think, as they said in a popular TV show, winter is coming, even though it's spring. We're staying busy with that. We're looking forward to meeting in person as an organization in early September as well. And in the meantime, we've been sort of collaborating and working through how to kind of get geared back up to in-person operations as we kind of share listserv tips amongst our membership. So that's kind of what's going on with us.
Thank you, Judge. Are there any questions for Judge Spitzer from members of JRAC? Well, hearing none, thank you again for all you do, Judge. It's good to see you. And the next call for a report out on behalf of the Public Defender Commission from Derek Mason. Hello, Derek.
Hello, thank you so much. So we at the commission are pretty excited to make sure everyone knows that we have some interesting assignments at the Summer Study Committee. We'd like to especially thank Representative Stewart and Fry related to the assignment of a topic covering the assignment of counsel at the initial hearing in criminal cases, including the capacity of the public defender system to provide counsel and the impact providing counsel has on jail overcrowding. So, as you probably all know, of course, the 2019 Jail Overcrowding Task Force raised concerns about the level of pretrial holds and bond amounts and how that contributes to jail overcrowding in Indiana. And one of the issues various stakeholders and legislators have been raising since then is the impact that access to an attorney at initial hearings has on bond and the pretrial hold decisions that are being made. And we all know, despite Criminal Rule 26 and the best practices that we are establishing related to that and EBDM, we know that not every county and not every court actually does provide counsel at initial hearings to all criminal defendants. And in an effort to provide information to the Summer Study Committee, I have now tasked my staff to start the process of conducting a statewide survey to gather data on which counties are providing counsel, who is receiving counsel, how much their program, if any, is costing in their county, and more information even than that. Obviously, our hope is that this will provide an understanding of where we are in Indiana as to the state of attorneys at initial hearings, and also to provide, hopefully, an accurate fiscal picture as to how much this counsel at first appearance and Criminal Rule 26 and how much that is actually costing counties, or how much it would cost if every county were to be doing it somewhat consistently. If you want to participate in that data collection process, which we're just starting this week, or you have any comments or questions, please reach out to me, or you can reach out to Andrew Cullen in my office, and we'll be happy to provide an update on what we find out about that at the next JRAC meeting as we move along as well.
Right. Thank you, Derek. Thank you. Are there any questions for Derek from members of JRAC?
Justice Goff, this is Mary Kay. I have a question for Derek. Derek, can you remind me, I know that there have been a number of counties who we've worked with on pretrial who had expressed an interest in providing counsel at initial hearing, but I think there was a question about reimbursement if that individual, depending on the nature of that individual's appearance, whether it was limited or whether or not it was for a felony case or a misdemeanor. Can you remind me what the commission's policies are on reimbursement for those?
So right now, because we count case appointments and we don't consider an initial hearing a case, it's just a part of a hearing. So we don't, it doesn't weigh against caseloads. And so we don't really have that's all the person does. we actually have created a new line on our request for reimbursement to allow them just to say, this is an attorney with no caseload, and to essentially make it fully reimbursable unless they're telling us that they are dedicated to just doing misdemeanors or something like that. Obviously, we can't reimburse misdemeanors by statute, although we're still trying to change that. If it's dedicated to misdemeanors, obviously that's something. But generally, we are reimbursing initial hearing work at a straight 40%.
So as you all work on that, our office, just because of our nature of our work with pretrial and certification, we probably have a little bit of insight into local practice, if that's at all helpful. And then Angie and her team do provide some grant funding that goes to public defenders and some prosecutors. So we can share that information if that's helpful as well.
Yeah, that would be very helpful to know which counties you're working with and with the information that you know about those counties, so that we're not creating duplicative efforts. But our goal is to be able to look at every county, both that's in the commission and not, and be able to report back to the summer study committee. This is what counties are already spending, and this is the percentage of counties that are providing counsel in these ways. That would be the goal.
Justice Goff, I would just something for Derek as well. Derek, I'm chairing the pretrial committee on the Supreme Court pretrial committee, so I would welcome the opportunity to review the report once you have it, and then we can also certainly, if you need help from us, would be happy to weigh in on that as well. So, but be really interested in seeing your report once it's done.
Yeah, hopefully we get cooperation and we get a good report. Even if a court's not doing it, if they can let us know. So as the judges communicate about this, we're going to be reaching out. We're starting with our public defense contacts that we have for all our participating counties. And then in our non-participating counties, we're probably going to be reaching out to the judges. And I know some judges will be hesitant to say, we don't do this or we do that. But even if we would need more money to do X, that's information that we want to be able to provide, because I really do think the information we're hearing on the ground is that the legislature could be interested in helping fund this at a state level.
So I know this won't be any surprise to you, Derek, or to Bernice, but when we've talked with counties about their ability to provide access to counsel at first appearance, sometimes it's money and sometimes it's not money. For example, we offered money and they say, we don't have enough attorneys who practice criminal defense to manage conflicts as well as do this kind of thing. And one of the counties that we worked with had to go out of county, and they just luckily found a defense attorney, actually two, who were willing to cover their initial hearing. So that's the workforce issue is a pretty significant barrier that we've seen, just for the benefit of others.
It is. And I'll tell you, some counties are hiring new people, and some counties are actually using existing people because it's not adding to their caseload, even though we all know it's more work. But let me say this, that there is a shortage of lawyers, and a lot of lawyers may be afraid to do these because they don't have a lot of experience in criminal law. If this is all they're going to do are initial hearings, I would like to think, and I haven't talked to Bernice about this, but I would like to think that we could potentially have a training in Indiana for people just related to how to do initial hearings, and that might expand our pool so that we're not even using our own existing public defense pool, which is already very limited, but just lawyers that would be, hey, I'm willing to cover those and you can train me exactly how I should be doing them. I think that would be a great way to kind of expand coverage so the attorney shortage is not hit so hard in this particular area.
Very doable.
Derek, I think that this topic's got a lot of interest, as you can tell. The one thing I would ask is you consider the offers for information that you've heard today, and to the extent you're able to convey the importance systemically of Judge Spitzer's pretrial committee. When you're having your discussion with the legislature, that this is really a multidisciplinary committee. It's the first time a conference committee of the Indiana Judicial Conference has included non-judges. And the idea is that they're going to be able to look at 92 different counties and offer an opportunity to have your pretrial practices certified, which would, of course, account for the different logistical problems in each county, including the problems with having clarity as to what constitutes a conflict of interest or not. There's going to be some new leadership in the disciplinary commission in the coming months. And so I think the importance of perhaps re-engaging the commission on that topic might be of interest to the committee and to you as well. But appreciate your work. Say, I'm confident we'll get a solution, but it's a big issue. So I'm glad that it's being undertaken.
Well, we're happy to help, but I want to say, I brought this up for two reasons. One, I want everybody to know about the survey that we're trying to do so that we can get your input and let you know we're happy to work with you on this. But also, we're not the only people, I hope, that are asking to speak at the summer study committee hearings on this. So anybody else, that has these groups that are trying to get certain things done, I would encourage you to decide whether or not you'd be interested in speaking out at the summer study committee to inform the legislature yourselves on what projects you're doing related to this, and the importance of it and the importance of funding it and the challenges with funding, because we can only do so much. We're trying to present them some state level information, but you know how it hits home to the legislature when they hear real personal stories about what's going on and what people are doing. So I would encourage everyone to consider about whether or not you would need to reach out to sign up to speak at this this group. And if you're interested in that, I'd tell you to reach out to me or Andrew Cullen, or I'm sure Bernice or David Bott, or if anybody that's over there working with the legislature.
Thank you, Derek, as always.
Sure. Thanks. My pleasure.
Next call on Senator Talion for a report out on behalf of the Senate Corrections and Criminal Law Committee.
Well, thank you, Justice Goff. I'll be brief. I'm not going to go over all of the bills that were passed out of that committee this year, but we are doing a CLE next week on legislative update, and we will be doing all of the criminal bills. I do want to follow up on something Derek said about the summer study committee. So Ledge Council met and they've assigned or approved a number of study committee topics. I'll just go over them real quick. One of them gets back to something that you all were talking about, and that's the costs and fees associated with juvenile prosecutions. The second one is sentencing juveniles to life without parole. Then there's the one about the capacity of the public defender system. And there's also a topic, jurisdiction over adults for sex offenses committed while they were a child. Now, frankly, I thought this bill passed. It moved back and forth. There were a number of renditions of this bill, but apparently it didn't pass because it's back on the agenda. And the question has to do with, if you had somebody who was a juvenile when the crime was committed, and then they're not being prosecuted until they're an adult, how does that fit in with statute of limitations, with what the penalties are for adult or child? Then there's the human trafficking study committee issue, and that's about it. There's also your basic multi-year review of criminal trends, sentencing, incarceration, treatment. And then I just want to say that we were real happy that we managed to get into the budget money for the public defenders to work with DCS. We tried that once. We tried to put it in the DCS budget. That didn't work. So we did an end run and gave the money directly into the public defender's budget to be able to do this. And so hopefully, Mary Kay, you were asking about implementation of the juvenile justice bill and how to keep people, what to do with the juvenile detainees Well, hopefully one answer is get more of them out of jail. So anyway, that's all I have. We haven't set any committee hearings yet, to the best of my knowledge. But I am on that committee this summer.
Thank you, Senator Talion. Does anyone have any questions for Senator Talion? Well, ma'am, I certainly appreciate your dedicated service and your willingness to participate and collaborate with us here at JRAC.
Of course.
My next call on Representative Wendy McNamara for a report out on behalf of the House Court and Criminal Code Committee.
Hello. I don't have much to add from the last meeting, just probably an update for CSG, the Council of State Governments, that's doing the review of the juvenile justice system. And we're in phase 2 of that review. And it's been noted that we need to add members because we're going to need to have several smaller working groups to be able to meet the capacity. One of the bigger problems that CSG is running into is the 92 different counties of 92 different ways of collecting data. So they're hoping that through the expansion of the task force, we'll be able to gather more data and have more integrity in the data in that way. But we're in phase 2. It was funded through the budget, so they're well on their way, probably 2 months into that phase right now. And probably around October, November, we'll be completing up that. And then the task force work will probably really begin and drilling down on what issues we need to focus on for the next session.
Good. Do any members of JRAC have any questions for Representative McNamara? Well, Representative McNamara is with Senator Talion. I continue to appreciate your dedicated service to JRAC and your collaboration with other stakeholders in the justice system. As we begin to partner with our local jurisdictions on a more organized basis through the local JRACs, I'm hopeful that we will come to some consensus on critical data points, and we'll be able to, as part of our technical assistance to our counties, share the importance of collecting data as to those points so that we're going to see more and more increased uniformity so that we can act accordingly and in an evidence-based fashion. So thank you.
Thank you.
And last but certainly not least, then I would call on Doug Hunsinger to make a report out on behalf of the Office of Governor Holcomb.
Well, thank you, Justice Goff. And I think everyone is probably aware of the decision the Scott County Commissioners made to close the Scott County Syringe Service Program on Thursday. We're obviously very disappointed that that tool in our fight against the drug epidemic will end on January 1st of 2022. But we're continuing to have conversations with the community and how we can be supportive of their efforts as they move forward. I will say I have had the opportunity to get back on the road, and it is wonderful to see all of the community collaborations and the different work that's been taking place across the state. A lot of that really seems to be coming back online. You know, went to the opening of a recovery cafe in Maryville that serves Maryville and Gary, and it was just really great to just be back in a room with a large number of individuals, but also to see people who have been in the justice system and have had challenges in life, really embracing recovery. So that was very exciting. And then, we've got a lot of work to do when it comes to our behavioral health workforce and, especially with all of the funding that's coming down, partnering with Jay's team on a lot of these challenges that will really set us up and set the systems that we regulate and fund up for the next few decades. So lots going on, and we're excited that we're going to be back in person very soon. So thank you.
Thank you, Doug. Do any members of JRAC have any questions for Doug? Well, Doug, on behalf of my colleagues and all of our constituent members, thank you for your service, and thank you to Governor Holcomb for his dedication to JRAC and its purpose. Is there any other business to be brought before the commission today? Well, very well, hearing none, I will indicate that the next scheduled meeting for JRAC is Friday, August 6th, and it will take place from 10 to 12 Eastern Time. If health conditions permit, we do plan to conduct this meeting in person. Due to technology limitations, we will be unable to host this as a hybrid meeting, allowing people to join in person and via Zoom. The meeting will take place in the South Tower Conference Center of the Office of Judicial Administration, and additional information will be included in the meeting invitation. I want to take this opportunity to thank each of you for taking time to participate in today's meeting and for your continued work serving our Indiana communities. Have a great weekend, everyone. We'll stand adjourned.